Hello, I'm Mrinalini Dey. I am a rheumatology fellow based at King's College London, and I am in Vienna for Eular 2024, reporting for Rheum Now. Today, I would like to highlight a really great abstract that I heard presented in the clinical abstract session for RA this morning in Vienna. And this is abstract 0202. It's part of the oral abstracts. And this is looking at ILD in rheumatoid arthritis. So as somebody who is quite interested in the topic of comorbidities and extra-articular features in RA, I was really excited to see this piece of work because this is looking at clustering phenotypes in RA-ILD. So as we know, RA-ILD is not just a single disease. We know from HLCT patterns, for example, that actually there's quite a lot of heterogeneity. But are there any biomarkers, for example, or other ways in which we can actually form clusters of disease to try and delineate it a little bit further? So this was actually results of an international collaborative study, actually included patients from 22 centers across 13 countries. So really good sampling and a good spread of patients. And there was a total of 1,696, so just under 2,000 patients who were included in this cluster analysis. And essentially, this study found that there was 2 clusters which were found, and the team did this by collecting a total of about 37 variables, but then 20 of these were used to construct the clusters. So just to give you an idea of what was in each cluster. So in cluster 1, they found that these people were more frequently male, older when they were diagnosed with RA, and when they were diagnosed with ILD, and more frequently of European ethnicity. So I guess that's where this kind of study really has its strengths. Because it was done across so many countries, we can even delineate it according to ethnicity and country of origin as well. They also found that there was certain variants of the MUC5B genotype, which was found more frequently in cluster 1 as well. So why is this important? Why does this matter? Well, as I said at the beginning, RA-ILD is a really heterogeneous disease. We are still trying to grapple with not only treating it, but also whether we can, for example, predict prognosis better in this group of patients. And to do that, it would be really helpful to be able to delineate subsets of patients as well. And so this is not only great for getting one step closer to being able to prognosticate for people with RA-ILD, but also try and tailor their management strategies a little bit more closely. And also when we diagnose people with RA, or we see that they're developing signs of ILD, it also helps us if we are able to group these patients into clusters, and therefore we have a better idea and understanding of prognosis and potential therapeutic strategies. So if you'd like to know more about that particular study, as I said at the beginning, that is 0P0202. And if you'd like to know more about anything else that's going on at Eular 2024, then do head to rheumnow.com. Thank you for listening.